think we can start this meeting. Actually, again, thank you everyone for lending your time with us. Okay, for this inauguration of our multi-center project or study entitled Multi-Center Implementation of OrthoGeriatrics and the Fracture Liaison Service for Elderly Hip Fractures, an evidence-based framework for a sustainable digital health registry in the Philippines. Okay. I'm very grateful, to all my mentors, okay, the admin officers, as well as the consultants and the residents of the different hospitals involved in this project. Okay. So first of all, I would just like to mention that why are we doing this project? So as you all know, even before the onset of the COVID-19 pandemic, the occurrence of fragility fractures or fragility fractures, for that matter, has already been tagged as an epidemiologic emergency by most experts. Okay, so it was mentioned that about there will be a 200% increase in fragility hip fractures, from 1.6 million to 6 million, in the span of 30 years, and more than 50% of these fractures will be happening in the Asian region. Okay, so it's about time that we become proactive and be prepared for the onset of this tsunami of fragility hip fractures. Because as you all know, when an elderly individual suffers a hip fracture, there's about 20 to 30% mortality risk in 1 year's time. Just imagine yung mga lola natin, our parents, who are previously active, even our titos and titas having this hip fracture, they will become high risk for morbidity and mortality, because almost 40% of them will not be able to walk independently again, and 80% will be dependent on somebody in order to carry out an activity of daily living. So it's very important not only to prevent these fractures, but also to treat those who have already these fractures. Because in reality, although we are dreaming of a nation or a globe without hip fractures, fragility hip fractures will really be here with us. It will keep on coming. So the concept of OrthoGeriatrics and the fracture liaison service must be promoted hand in hand in order to complete the cycle of care for patients, for elderly patients with the fragility hip fractures. Okay, so to start our meeting, I will first call on the Chancellor of the University of the Philippines, Manila, who's always been supportive of us. Actually, since 2017, when we planned and started the OrthoGeriatric and Fracture Liaison Service here, the first Fracture Liaison Service in the Philippines, Chancellor Padilla was there with us to support our project. And now, even if she is in another country and she's very busy, I just informed her last night actually. So I might be reprimanded for this, but I'm very, very grateful to Ma'am Menchit for gracing our launching today. So Ma'am Menchit, Professor Menchita Padilla.
I'm in the Philippines, Erwin, but I had a multi-country meeting last night, hosted by the UK AMS also last night. So when we were meeting, that was early in the morning. But again, well, thank you very much for this opportunity to be a part of this exciting project that's hosted again by the Department of Pediatrics. So Dr. Juanito Javier, the department chair, Dr. David Marsh, Professor Pasion, the faculty, staff, and guests from the different hospitals. Pleasant good morning, good afternoon to all of you. It is a pleasure to welcome you and be part of this launch of the Multicenter OrthoGeriatrics Fracture Liaison Service Expansion Project. We are heartened by the continued focus of research efforts on the health of this special sector, considering there is really an increasing number of the elderly all over the world and even here in the Philippines. So through this expanded project, we hope that we can be of service to this population. The Multicenter OrthoGeriatrics fracture license service expansion is a first in the country. That started, the planning started in 2017, but eventually moved and become formalized in 2018, and with the aim of improving the pathway of care for the elderly patients with hip fractures, now considered worldwide as an epidemiologic emergency. And since then, the project has been proving to be a vital testament to what research can do to improve the lives of the special sectors of patients. Being a senior citizen, I can really appreciate the efforts of the department in making sure that we do not only take care of the young or the middle young or the middle old, but especially the senior citizens of our country. So for several years now, and especially since the start of the pandemic, research has proven foundational and pivotal in generating quality data and serving as a backbone of clinical pathways for care. And for this special sector of our population, the elderly with hip fractures, research has again shown its importance by providing the basis for recommendations to the future programs of the Department of Health in line with the universal health care. I'd like to inform our guests, especially Dr. Marsh, that the Department of Health is a major partner, that the University of the Philippines and the Philippine General Hospital are major partners of government. And they listen and they wait for recommendations coming from our institution so that we can actually develop policies out of the data that we generate. I think for the start, as starters, the use of digital technology in developing health registry is indeed auspicious and going to be a big boost to the project. And all the more, during the pandemic, we realized that digital world has to be part of our work, has to be part of our life. Now, if I still remember, because I was also part of it in last year in September 2021, the UPPGH hosted the second Asia Pacific virtual pocket meeting with the theme Developing the Workforce in the Asia Pacific region in support of the WHO's Decade of the Healthy Aging 2021 and 2030. And I'm really glad that despite the pandemic, the department did not ignore the other sectors that needed attention. In that particular webinar, that webinar proved that which aimed to improve the clinical outcomes for elderly patients with fragility fractures, where the National Fragility Fracture Network leaders from the Asia Pacific region presented their respective hip fracture registry experiences. Well, I think that one really signaled the setting up of the National Hip Fracture Registry in the country, and we need leaders in the community. And I thank the Department of Orthopedics, the faculty, and of course, Dr. Tabo especially for taking the lead, because we need people to take over and make sure that the future is going to be bright for all of us, the older population. From that sharing of experiences and best practices in that webinar, we learned a lot. And I think we're building on that one. The expanded project now is a testament to what we gained from that webinar. It will be supported by the digital health registry being developed with the help of our IMS information management services. And I really hope that we're able to sustain this for the future. To our guests, I'd like to let you know that I just want to inform you that UP Manila is committed to this kind of endeavors. We continue to address not only the prevailing great challenges of COVID, but we'd like to make sure that to ensure that the least collateral damage are given to the other health concerns. So we are all being called upon now to make sure that other medical conditions like the fractures are being given focus by the Department of Orthopedics. UP Manila will always be challenged to find solutions to pressing health problems. We never run out of problems, and we will never run out of energy to make sure that we find a solution. This is our mission. Our task and responsibility that we find solidarity and commitment with our partner institutions. I really want to thank the DOST, the PCHRD for funding this project, because without our funding institutions, that we will not be able to move on with our mission. So I thank PCHRD for recognizing this problem and responding swiftly by providing funding for this project. And as a leading health research university, UP Manila will constantly support these kinds of endeavors. It has been our mission from day one to help the young. And I consider Dr. Tabi to be a very young faculty member and the other young faculty members of the university. If you have a bright idea to consider, we will be here to support you. So once again, I want to congratulate the department, especially your team, and all the mentors like Dr. Pasion who stayed with us, despite beyond retirement. And we need the seniors, the middle, and the young to make these things happen. And I thank our partners from overseas for being our mentors. We need your experience, we need your guidance, and we hope they can help us all the way. So thank you again and good afternoon, and congratulations.
Thank you very much, mentioned Professor Padilla, for the continuing support, to all the programs of the Department of Orthopedics, and not only the department, but the extension to the Philippine Orthopedic Association, and even to the Asia Pacific region. And it's good to mention that the pocket meeting was actually a collaboration with the Regionalization Committee of the Fragility Fracture Network, which was headed by Professor David Marsh. So it was really a very good collaboration, and it sparked many interest in establishing hip fracture databases in the Asia Pacific region. So thank you, ma'am, for gracing our meeting today.
Thank you.
Okay. So at this point, we would also like to hear from the chair of the Department of Orthopedics of UPPGH, Dr. Juanito Javier, who's really been very supportive of this endeavor. As you all know, during the time of the pandemic, UPPGH has been tagged as the COVID center of the Philippines, and we really had a hard time carrying out our mandate, as a specialty center, because most of the beds were taken up by COVID patients. But through the support of the department, we were still able, especially the residents, the fellows, and all the consultants, we were still able to keep the OrthoGeriatric FLS unit of UPPGH afloat. So with that, I'd like to call on Sir Aning.
Thank you very much, Irene. Good afternoon, everybody, and welcome to this launching of the Multicenter OrthoGeriatrics FLS Hip Fracture Registry Project for the Filipino elderly. And let me acknowledge the presence and thank you to Chancellor Menchit Padilla, to Professor David Marsh, Dr. Edward Wang, Per Kathleen Cotumlos, and Dr. Errol Beronio from the OST. I also see familiar faces, senior orthopedic consultants like our former chair, Dr. Lewy Pasion, and I can see also Dr. Jeffrey Bata, Dr. Mel Ramos, and many other orthopedic consultants who are supporting this project. But let me not forget to acknowledge the presence of our partners, representatives from the 14 major medical institutions, namely, 1, Baguio General Hospital, Bicol Region General Hospital and Geriatric Medical Center, the Cagayan Valley Medical Center, East Avenue Medical Center, the Jose B. Lingad Memorial Regional Hospital, the Jose R. Reyes Memorial Medical Center, Northern Mindanao Medical Center, of course, the Philippine General Hospital, the Philippine Orthopedic Hospital, Quirino Memorial Center, rather it's a Philippine Orthopedic Center, POC, sorry, Quirino Memorial Medical Center, the Veterans Memorial Medical Center, the Vicente Soto Memorial Medical Center, the West Visayas State University Medical Center, and the Western Visayas Medical Center. So there are 14 institutions involved in this project, in this team effort. Congratulations, Dr. Irene, and to your team for being able to gather all these institutions in the different parts of the country for this common cause of improving our response to elderly hip fractures. And today, we are taking another important step towards that goal. There will be many challenges ahead for all of us involved in this undertaking, and I am certain our enthusiasm will not wane. All the institutions I've named here are equally valuable if this project is to be a success. So let me stress again, this is a team effort with all the 14 institutions. And I'm so happy that the Department of Science and Technology has given its full support for this project. And I have no doubt, or I'm very certain that the University of the Philippines, Manila, under Chancellor Menchit Padilla, will always be behind this project. The other challenge is for us to encourage more institutions to join so that this project will be truly a nationwide registry. So tuloy na itong proyektong ito. This project is already a go. Talagang oras na para magkaroon tayo ng ganitong proyekto sa ating bansa. It's about time that we have this registry. And again, welcome and good afternoon.
Thank you, Dr. Javier, Sir Ani, okay, for continuing to support this program. Okay, and at this point, Dr. Javier already had the roll call of the participating institutions, but I would like again to recognize, the participation of the 14 institutions who, as I've said, kept an open mind and wanted to also embrace, the orthogeriatric care and secondary fracture prevention, as well as excellent rehabilitation in their respective hospitals. So again, I would like to call on the hospitals with the lead site coordinators of their respective hospitals, namely the Baguio General Hospital and Medical Center with Dr. Leo Franco. Okay. Bicol Regional General Hospital and Geriatric Medical Center, which is a geriatric center under the Department of Health. Their team is led by Dr. Elvin Panliboton. Cagayan Valley Medical Center, led by Dr. Anthony Abogado. Of course, East Avenue Medical Center, led by Dr. Geoff Batad. The Jose Bilingad Memorial Regional Hospital, led by Dr. Rene Manalastas. The Jose Reyes Memorial Medical Center, led by Dr. Melito Ramos. The Northern Mindanao Medical Center, led by Dr. Leonard Ku. Philippine General Hospital, led by Dr. Bernard Alpuerto. The Philippine Orthopedic Center, led by Dr. Alan Brabante. The Quirino Memorial Medical Center, led by Dr. David Vincent Antonio. The Veterans Memorial Medical Center, led by Dr. DJ Pacheco. The Vicente Soto Memorial Medical Center, led by Dr. Philip Bacli. The West Visayas State University Medical Center, led by Dr. John Yap. And last but not the least, the Western Visayas Medical Center, led by Dr. Lucille De Toyato. So these are 14 centers, 14 of which are hospitals under the Department of Health and 2 university hospitals. Also included is the National Orthopedic Center, which is the lead orthopedic hospital in the Philippines, and of course the Philippine General Hospital, which is the National University Hospital. Okay, so I would like to thank all the participating hospitals, not only the orthopedic surgeons, but your respective teams in your hospitals, which includes internists, family medicine doctors, rehab doctors, anesthesiologists, who will also be essential in carrying out our goal to promote orthogeriatrics, our multidisciplinary care in our respective hospitals. Okay, so moving on, now at this part of the program, we will be calling on some of our supporters. First, I'll make a bit of a change in the order of those who will give messages. I'll first call on Professor David Marsh, because he has a meeting in 15 minutes time, to give a message, regarding orthogeriatrics and how the Fragility Fracture Network can support our goal, as we promote orthogeriatrics in the region. Dave?
Hello, good afternoon, everybody. Thank you very much for including me in this exciting project. I just want to bring a message of congratulation and good wishes from the Global Fragility Fracture Network. As Erwin has already said, we have an epidemiological emergency due to the aging population. And it's amazing how many people say that the incidence of hip fractures is actually falling in some countries, but what they mean is that the age-specific incidence is falling, but that is far outweighed by the aging of the population. So on a global scale, we're looking to see a doubling of the number of cases in the coming decades in the developed economies and up to 6-fold increase in the emerging economies. And in all these areas, the current trauma systems won't be able to cope. So we set up the FFN in 2011 to address this challenge. So although we're a global organization, we're now creating national FFNs, and I'll explain why. And in Asia Pacific, we have 13 so far, of which FFN Philippines is a leading member. The FFN laid out what we feel needs to happen about the challenge of fragility fractures in this paper in Injury in 2018, along with other organizations. And we can describe what we say needs to be done in terms of 4 pillars, of which the first is multidisciplinary acute care. Why do we need that? And this is the basic argument, that although we need high quality surgery, obviously, particularly for hip fractures, it's not sufficient by itself, because these patients have got 2 different problems. The fragility of the bone due to osteoporosis is a biomechanical problem, but they also have frailty of their whole body, which is a physiological issue due to aging. And frailty is a well-recognized geriatric syndrome, meaning that the patient cannot tolerate stressors as much as a younger person. In particular, they have a weakness of the muscles due to sarcopenia, and as you know, it's often accompanied by cognitive dysfunction and many comorbidities. So that's why we need geriatrics, because that is the branch of medicine that specializes in the management of frailty. Other physicians can acquire the competencies of geriatricians and looking after managing frailty, and in many countries, trained nurses can do so as well. So there must not be any despair in places where there are few geriatricians, because the principles of geriatric medicine can still be applied. And if they are applied together, this combination of orthopedics and geriatrics is very beneficial, leading to better outcomes, shorter length of stay, and reduction in complications and readmissions. So we use the word OrthoGeriatrics to describe that essential combination between people capable of managing the bone fragility and people capable of managing the physiological frailty. Well, is there evidence that this works? Well, the evidence is mounting at a tremendous rate. If you put in OrthoGeriatrics in Google Scholar, this is the trend of citations that come up. And you can see there's a huge number of publications now. I'll just mention one, which is very recent from Belgium, and which is a good overview because it is a meta-analysis of a large number of control studies with 37,000 patients. And the overall conclusion of the OrthoGeriatric models is that the length of stay is reduced, the in-hospital mortality and 1-year mortality are reduced. There's a reduction in other complications such as delirium, and by and large, it didn't seem to matter what precise model of orthogeriatric co-management is used. The benefit is consistently there. The second pillar that we advocate is rehabilitation. There's absolutely no point in keeping a patient alive and having a beautiful X-ray if they can't do anything. So we have to regain function, because regaining function means that we're regaining independence and reducing the burden on society of dependence due to disability. The third pillar is prevent the next fracture. As you all know, once you've had one fragility fracture, you're more likely to have another one than people who have not had a previous fracture. So secondary prevention is the lowest hanging fruit for prevention of osteoporosis-related fractures. And it's not a case of only looking after bone health and treating osteoporosis. It's also a matter of preventing falls, because by and large, however fragile your bones are, in general, you don't break them unless you fall, except, of course, in the case of the vertebral fractures. The fourth pillar is making those other three pillars actually happen. And we've discovered in many countries that, as well as needing teamwork at the local clinical level, there needs to be multidisciplinary teamwork at the national level, pushing for the policy change that is needed to resource the three clinical pillars that I've described. And this meeting today is a celebration of your progress in this fourth pillar of advocacy and policy change and its dependence on data. So this has to happen on a national level, because that's where healthcare policy is determined in a given health service. And that's why we need the national FFNs. We need them to do the education and consciousness raising among colleagues, and we need them for advocacy at the national level to actually deliver the resources needed for the clinical pillars. And the big guns in that battle are the established professional associations, the National Orthopedic Association, geriatrics, nurses, etc. But what the role of the FFNs is to be a catalyst to get them to work together and speak with one voice. So if you don't have an orthogeriatric trauma unit, then I really want to stress that you mustn't be disheartened. As I've already said, the geriatric competencies, the ability to manage frailty, can be taught to other physicians and specialist nurses. And this is a high priority for the global FFN. Our education committee is in the process of designing web-based courses to teach geriatric competencies to other physicians and other health workers. The same applies to secondary prevention. It needs to be reliable. It needs to happen after every fracture, not just occasionally. And again, it's a question of multidisciplinary teamwork. You need osteoporosis doctors, you need rehabilitationists, but what they really need is a fracture liaison service where there is a coordinator employed solely for the role of bringing fragility fracture patients to these relevant services, which in many places already exist, but they don't see the fragility fracture patients that need them. And then just to stress and to celebrate today's inaugural meeting, systematic performance measurement is a powerful driver of positive change. We have seen this now in so many countries, and it applies equally to multidisciplinary acute management on orthogeriatric lines and to secondary prevention. In the UK, we started it in 2007, and you can see that the National Hip Fracture Database drove the increase in the percentage of patients getting prompt surgery, orthogeriatric co-management, and secondary prevention. The number of patients, percentage of patients who got all those things went up from 24 to 66% in the first 5 years, and that trend is slowly but surely increasing even further. That is the power of data, and that is why your project that you're celebrating today is so fundamentally important. You will stimulate service development both in the acute care and in secondary prevention, and that will end up saving both lives and money. And we said to the politicians in the UK, looking after hip fractures well is cheaper than looking after them badly. This was a powerful message. I wish you all the luck in the world from the global FFN. Thank you very much.
Thank you, Professor Marsh. As I mentioned, Dave is the founding father of the Fragility Fracture Network, and was also the founding father of the National Hip Fracture Database in the UK. And he's been all around the world promoting OrthoGeriatrics, the multidisciplinary care of fragility fractures. And as he mentioned, the importance of a coordinator. And with this project, the funding will be diverted to the coordinators, which will be allotted to each institution. So each institution will have the opportunity to have a coordinator, which some amount of the funding for this project will be earmarked. So with that, I would like to call on, or we would like to play the message from the Department of Science and Technology. Okay, this is the funding agency for this multi-center project. The message will be given by Ma'am Pearl Kathleen Cotumlos. She is the program coordinator of Digital and Frontier Technologies in Health Program of the Department of Science and Technology. Can we share Ma'am Pearl's message, guys?
Yes, sir. One moment lang po.
I think there's no sound.
Arvin, I think dapat i-start with the sharing of the audio.
Okay, so while we are sorting that out, we will move first, to our next guest, who's also one of the people or person responsible for this project. He's actually the immediate past chairman of the UPPH Department of Orthopedics, and now also a member of the National Academy of Science and Technology, and the program leader of UPCBOL. As you all know, I entered the department with him as the chair, and during my second year as a young consultant, he gave me a task to look into OrthoGeriatrics and the fracture liaison service without knowing anything about that. I think that was in 2014. So from that time on, I was my mind was stimulated to look what's OrthoGeriatrics, what's the fracture liaison service, and since then, it has come into this, that we were able to at least introduce OrthoGeriatrics in the fracture liaison service. So with that, I would like to introduce Professor Edward Wang to give us a short message about our meeting. Sir Wang. Hi, sir.
Yes, can you hear me?
Yes, sir.
Okay. Thank you very much, Arwin. Sorry I came in a little late, but I'm here actually on Arwin's invitation to represent the National Academy of Science and Technology. But what I'd like to do is really to start off with a very short history of what Arwin actually already began to talk about. It's a short backgrounder of events that led up to today. I remember having received an invitation almost 5 years ago to attend an event in Malaysia on the management of fragility factors in the Asia Pacific region. And I still remember very well where I was in the specific time of day when I endorsed Dr. Irwin Tapu and one of our orthopedic nurses to that meeting. So not only did Dr. Tapu attend this meeting, he imbibed it, poured his heart into it and soul into it. And together with the team he had gathered together, he launched the UP Manila PGH Multidisciplinary OrthoGeriatric Fracture Management and Fracture Liaison service shortly afterwards. Now, with his initial successes and experiences, he teamed up with other hospitals and colleagues also pursuing this course, and over a short period of time, had not only initiated and refined the local program, but he had also become actively involved in the international organizations dedicated to orthopedic fracture care, such as the Global FLS, Capture the Fracture Program of the IOF, and the Global Fragility Fracture Network. Now, most importantly, their team has given better meaning to the terms collaboration, alliance, and network. The Philippines is not lacking of expertise in fragility fracture care, but like the problem we want to solve, we were sometimes fractured in our approach, and oftentimes we were working in silos. So today marks the piecing together of these fractured fragments with this team approach that Irwin and his team have shown so well. Now, as a member of the NAST, or the National Academy of Science and Technology, we have already submitted this topic as an advocacy topic, the orthogeriatric fracture. This has been submitted and approved by the chair of the Health Science Division, academician, and the PCHRD director, Jimmy Montoya, and the president of the NAST, academician Asansa. So meaning therefore an assurance of full support for the program and its projects. I think I can safely say that the National Academy of Science and Technology looks forward to working with the team in coordinating the project and helping us to reach out to more stakeholders and populations across the country. Now I end with this. Today is April Fool's Day. So ang tanong dito, tuloy na nga ba talaga? So to Professor Mars, what I meant was, today's April Fool's, so is this project really pushing through? I know initiation of this project has been delayed a few months. Like all new and pioneering programs, it is going through birthing pains, aggravated by the pandemic and sometimes man-made restricting rules and regulations. But at the same time, we have seen full support given it by both the PGH director and the UP Manila Chancellor, who is here with us today, and full support from the department chair, Dr. Javier. Full support from our alumni, led by the ASEAN Secretary General and the soon to come in APOA President, Professor Passion. So you have full support from all of these sectors. There will continue to be hurdles and obstacles, some still there, but patience, perseverance, and purpose has brought you to this day. Congratulations again, Dr. Tabu, and to the team, and to the entire group of collaborators. Thank you.
Thank you, Sir Ewang. That's actually music to our ears, no? In these times of these challenging times, no? It's really a challenge and very difficult to really carry out things. But with the support of our mentors, no, it makes it easy for us. No, it gives us the inspiration to carry out things. So I'm very, very grateful for all the support, no, Sir Ewang, and to all our mentors. So thank you very much. And at this point, I think we can run the message, no, from the Department of Science and Technology. I think this is very important because without them, no, it would be very hard or difficult to carry out this project.
Good afternoon to all, and it is an honor to take part in the launching of the PCHRD-funded project, Multicenter Implementation of OrthoGeriatrics and the Fracture Liaison Service for Elderly Hip Fractures, an evidence-based framework for a sustainable digital health registry. I am Peral, the program head of the PCHRD's Digital and Frontier Health Technologies Program, formerly known as the Information, Communication, and Technologies for Health Program. We are excited for the official start of the implementation of the project, which has been 2 years in the making. The project will contribute to addressing the World Health Organization and the United Nations Declaration of the Decade of Healthy Aging, which spans from 2021 to 2030. It will address the need to update the country on the care and management of the geriatric population, specifically through improvement of fragility hip fracture care based on a cost-effective combined model of care. With the implementation of the project, together with its collaborators from participating hospitals, medical societies, the Department of Health, the University of the Philippines, the National Institute of Health. We expect that the project will be able to develop a prototype database on fragility hip fractures. In addition to conducting capacity building activities through the creation of an operations manual on data management of patients who will experience this combined model of care, it is our eventual hope that this combined model of care will further propel the Philippine healthcare system to address the needs of our elderly and lead them to have a better quality of life. We would like to congratulate Dr. Tabu and his team for pursuing this project, which is innovative and holistic in nature. Through their efforts, we also hope to propagate not only the orthogeriatric fragility, fracture management, and the fracture liaison service as a combined model of care, but also the digital health to provide cost-effective and efficient solutions for healthcare management and service delivery. Congratulations, and we look forward to seeing a better future for elderly health care.
Thank you to Ma'am Pearl, no, and that the staff of the Department of Science and Technology. I think Geraldine is here, no. Geraldine from UST is very helpful, no, in assisting us carry out this project. And it's true, it's been 2 years since we've applied for this project. We've sacrificed that sweat and tears, many sleepless nights in revising the protocol, defending why this project should be carried out, no. And we're very happy and that after 2 years, no, with the help of all the institutions, participation of the institutions, hopefully we'll be able to carry this out, and we'll not only for 2 years, and our hope is for it to be sustainable. Okay, and bridging that hope for this project to be sustainable, of course, there should be the Department of Health. There should be partnership with the Department of Health, especially now that we are rolling out, no, the programs for the universal health care. And with that, no, we're very fortunate to have, a point person at the Department of Health, no, who's been previously Dr. Mimi Binluan. However, now she's gone into early retirement. We are happy to be with us today, no, Dr. Errol Jason Beronio, no. Dr. Beronio is a medical officer for, no, in the non-communicable elderly health and special populations division, no, under the Disease Prevention and Control Bureau of the Department of Health, and is the upcoming program manager of the Health and Wellness Program for senior citizens. So, Dr. Errol, thank you for gracing our inaugural launch of our multi-center project about orthogeriatrics and the fracture liaison service.
Yes. So first of all, I would like to thank Dr. Tabu, no, and Dr. Javier for inviting me to this launching of your activity of the study. No? So yes, I agree. Dr. Mimi Binluan is retiring. That's why the responsibility of handling the program of the health and wellness for senior citizens is passed down to me. So within the DOH and the legal issuances that institutionalize programs to address the needs of the population, we have the health and wellness programs for senior citizens, and this program aims to address the health issues and to promote the health of our lolo and lola, or our older persons. And within this, one of the many geriatric symptoms and issues concerning our older population would be frailty and fragility, which is the focus of this talk. Now, I'm glad that this is a very big milestone for Dr. Tabu and the health system in general. Kasi we would be looking forward to partnering with you, especially that this study is aimed at creating a database. Because in order for us to craft policies that are relevant to addressing the needs of our patients and work hand in hand with our stakeholders, we have to have data to back it up. And the involvement of the creation of this databases involving a large number, I have seen the hospitals involved, no? And I agree. I have to say congratulations kasi it's not a very easy task, Dr. Tabu and the team. So on our end, I agree with the previous speakers, no, that the project has to be sustainable. And one of the building blocks of the health system is a information database, which would also help us further attain the goals of the program. So with that, thank you po again, and I'm looking forward to work with you, sir.
Thank you, Doc Errol. No, as I've said, I think it's pointless to start a project if you don't see any sustainability, no, on the horizon. No, it's just like wasting time. But with the help of DOH, of course, DOST, no, of course, the academic side, UP Manila, I think there's a possibility, a big possibility, no, and with the guidance of our mentors overseas, no, who has been experts in rendering or in doing big databases, no, supporting various clinical pathways of care. I think we will be able to make this a sustainable program and a useful program at that, no, with the data and the results of the project, no, being basis for recommendations for future programs of the DOH for patients with the fragility fractures and maybe for all other common health diseases, no, if this this pathway of care or this program will be successful. So that's our hope, no, and it will be very supportive to the universal health care mandate of the government. So yes, thank you very much. Okay, so at this point, of course, no, all of these things, no, will be useless, no, if the patients will not be happy. No, all these programs, all this pathway of cares, no, it will be useless, no, because at the end of the day, it should be the service to to the elderly people, no. That's the main focus of the program. So I'd like to thank our fracture liaison coordinators, no, especially Nika, no, for having an interview with our patients, no, for the past 2 years. And at this point, we would like to play some testimonies of our patients, no, at UPPGH, no, who were involved in the fracture liaison service. No. Guys, can we run the testimony of some of our patients, no, so that our colleagues from other hospitals would also be inspired? No, this is what keeps me going. No? Seeing these patients, no, entering the hospital in pain, almost helpless, no, crying in pain, but after a few weeks, you will see them walking and being productive members of the community again. Okay, so let's watch this.
Ako po, si Pidela Arcalamberio, isang COVID positive patient po na nabalian ng balakang. Ako po lubos nagpapasalamat sa FLS, sa PGH, na malaki po ang naitulong sa akin. At maganda na po ang aking pakiramdam sa katawan ko. Yung hindi ko nagagawa, nagagawa na po ngayon. Nagwawashing na po ako. Kaya lang po nakatayo, hindi ako pwedeng nakaupo. Pero ayos naman po. Nakakalakad po ako na wala ng walker. Magandang pakiramdam ko, masiglaw ang pakiramdam ko. Nakakapagdilig na rin ako ng halaman ko. Kaya lang hindi ako nakakapagbitbit ng mag-ang lang, isang pitsil lang po. Naladala ko sa pitsil, pabalik-balik, pagdidilig. Pero ayos po. Kaya lubos po ako nagpapasalamat talaga sa FLS, sa PGH, na malaki po ang tulong, na itulong nila sa akin. Ngayon po talagang ayos naman ang pakiramdam ko. Pagtulog ko po, ayos naman po. Yun lang po ang masasabi ko. Maraming po salamat talaga.
Maraming salamat po sa FLS at PGH. Ginamit po kayo ng Panginoon para po makarecover po ang aking nanay, makakilos, makalakad po ng hindi na siya nahihirapan, Maraming salamat po sa pag-aalaga ninyo. Hindi po namin naramdaman na ni minsan pinabayaan nyo kami. Maraming salamat po, pagpalain po ang lahat ng bumubuo ng FLS at ng PGH. Maraming salamat po.
Ako si Maximo Maravillas, isa sa mga na-opera ng PGH sa pamamagitan ng FLS. Malaki na itulong sa akin ito. Dahil dito ako'y mabilis na-recover dahil sa mga ginawa nilang mga follow-up through online check-up at mga exercises na ginawa sa akin. Dahil dito, naging mabilis ang recovery ko at naging mataas ang kumpiyansa ko na ako ay makaka-recover kaagad. Sa ngayon ako ay nakakapaglakad na kahit walang gamit nung tungkod at nagagawa ko na yung iba pang mga gawain dito sa bahay at doon sa bukid. Malaking pasasalamat ko sa aking mga orthos at sa kay Nika na siyang walang sawang tumutulong at papalo up ng kondisyon ng aking buwan. Maraming salamat sa inyo at sa mga iba pang mga gumaganap ng kanilang tungkulin dyan sa FLS. Thank you sa inyong lahat.
Po si Leonardo Cunanan sa edad po ng 74 at ako po'y nagpapasalamat sa FLS nung malaking tulong na ibinigay sa akin nung pagkaka-opera ko po sa aking binti. Kaya sa ngayon po, naka-recover na po ako ng aking paglalakad at nakakapagmotor po ako ng maayos at saka nagpapasalamat din po ako sa pagkaka-online na check-up sa akin po. At lalo na rin po kay Ma'am Nika. Kaya lubos po akong nagpapasalamat sa kanila.
So yes, no, these are the patients, no, who make us, give us energy to carry out this program or this endeavor, no. Yung po nga yung isa, nagmomotor na, sana wag lang matroma. So Nika, pigilan mong magmotor ha. Baka hindi natin kaya yun. Okay. So at this point, I would just like to, as part of my closing remarks, I would just like to share some slides, okay, of why we really need to carry out this program, okay. Allow me to share my screen. Okay, so last year, the Fragility Fracture Network carried out a survey, in line with the Fracture Pathway Mapping Tool Project or the FRMAT project, which was spearheaded by Professor Matt Costa from Oxford University. Professor Matt Costa is the immediate past president of the Fragility Fracture Network and one of the leading epidemiologists and orthopedic surgeons in Oxford, who makes recommendations to the NICE guidelines in UK. Okay. This survey, the FRMAT survey, okay, was answered by at least 23 countries, no, and mostly in the Asia Pacific region, including the Philippines. I think some of the responders are here today, no, our partners in this multi-center program. So, what have we learned, no, from this survey? This is based on just preliminary data, unpublished data. We'd like to thank Professor Costa for sending us and lending us this data, no, so that we can sort of give our viewers a glimpse, no, of the importance of this project. Okay, so of course we all know of the quality standards, but these are all Western quality standards. No, it's been seen in literature that surgery for patients with hip fracture should be carried out within 36 to 48 hours. There should be a joint elderly care between orthopedic surgeon and the other specialist, preferably a geriatrician. But if there are no geriatricians, the internist or the anesthetist who are indoctrinated, no, with the orthogeriatric care principles. First, there should be a pathway or an assessment protocol. No, a geriatrician or internist must see the patient within 72 hours. No, and then there should be a well-coordinated multidisciplinary rehabilitation. There should also be fracture prevention protocols, no, and most importantly, osteoporosis and fragility fracture or refracture prevention protocols, as well as pre and post-op delirium assessment. Because as we all know, I mentioned earlier, for those patients with the onset of delirium, the mortality risk, no, the 1-year mortality risk increases from about 20% to 40% if delirium already sets in. And delirium is brought about by the pain condition of the patient and the imbalance, electrolyte imbalance for those patients who have had delayed surgeries. Okay, so these quality standards, they make a difference to patients and quality of life in the UK and other developed countries. But what about in the other countries? Okay, so let's look at the research, the results of the survey regarding the average time in days between admission and surgery for patients with hip fractures. So we can see here for the Philippines, no, most of our patients, the average time between admission and surgery is still more than 5 days. Okay, as seen in this graph. Okay, if you compare it to many countries in our region, we are a little bit behind in this field. Although most countries in the Asia Pacific region also have the same problem. Okay. As regards to the question, how long does it take on the average for patients with a fracture to reach the hospital, no? From the time that the injury occurred. Okay. Again, for the Philippines, the average time is about 1 to 2 days. So doon pa lang late na tayo, no? So with this graph, we see that we still need to strengthen, no, the education, okay, maybe in the primary care setting regarding education, no, about the urgency of bringing elderly patients with hip fractures to hospitals. Okay. With the question in your hospital, do patients have a routine assessment of delirium? No? Sa Philippines, 0 tayo. In most of our neighboring countries, at least they are already assessing this risk factor. But in the Philippines, as in 0, no, out of all the respondents, including us here in the Philippine General Hospital. Okay. In the perioperative period, do patients with hip fractures in your hospitals, no, do they have a routine formal assessment of their falls risk? Again, majority, almost 80%, no, of the respondents say no, no, in our country. So again, this is a very important data. For the question, in the perioperative period, do patients with hip fractures in your hospital, do they have a routine formal assessment of their bone health or osteoporosis risk? Majority, no, 75%, no, we don't assess the patients for their refracture risk or osteoporosis risk. So again, this is the importance of our project. So, but however, this is quite a positive remark. Is improving care for patients with hip fracture a priority, no, in their healthcare system? The majority said yes, 75%. So at least, although we are not yet there, majority of us really want to improve, no, the management of patients with hip fractures. So with that, no, our multi-center project actually does not only involve orthopedic surgeons, but it is a multidisciplinary endeavor. So the other cooperating agencies involved in this program are, of course, the Fragility Fracture Network Philippines, the Philippine Orthopedic Association OrthoGeriatric Osteoporosis Working Group, the UP Manila NIH Institute of Aging, and of course, the Osteoporosis Society of the Philippines Incorporated. Because as Professor Marsh has mentioned, this should be a multidisciplinary endeavor. That's why I'm appealing to the participating institutions to call upon the other specialties in your respective hospitals, no? Because this endeavor will not become successful if only orthopedic surgeons will be the leaders. We should bring and we should uplift, no, the knowledge of our counterparts, no, IM, family medicine, anesthesiologists, our rehab doctors, family medicine, and the nurses, no, as regards to imbibing the orthogeriatric care principle. Okay, so hopefully, no, at the end of this project, we can institutionalize the orthogeriatric fragility fracture management and FLS pathway of care for elderly patients with hip fractures, no, not only to the 14 starting hospitals who are involved in the project, but hopefully in the second phases, it will increase to 25 because that was our original request to the Department of Science and Technology. However, we have to trim this down due to budget concerns. Okay, and included in the outputs are the health policy recommendations on both bone health in the elderly, mandating the formation of cost-effective orthogeriatric units and fracture liaison service in hospitals, and of course, generation of an electronic data collection framework, which includes key performance indicators, which can be used as recommendations to the Department of Health. Okay, so this is the gist of our project, and we will be using the REDCap or the Research Electronic Data Capture, a web-based tool, no, which was developed in Vanderbilt University as our instrument for the collecting data. And this web-based tool is HIPAA compliant, it's very secure, and it's easy to use. So hindi natin pahihirapan yung buhay ng mga tao. And of course, we will provide or we will encourage each hospital, no, to have a fracture liaison coordinator like Nika in PGH. And these coordinators will have honorariums. They will have honorariums para naman medyo meron silang paggasolina at pagkape. Okay? So, with that, ito yung pinaka-gist ng ating programa. So hopefully, no, the participating institutions will really feel and see the importance of really carrying out this project in their respective hospitals, no? And parang basketball, no? Kailangan hindi lang lagi isa yung superstar. We really need to uplift our team members, no? That includes the other services. And because that's the essence of OrthoGeriatrics and the fracture liaison service. It's a multidisciplinary endeavor. Okay. With that, I would like to thank everybody, no, for gracing this inauguration activity. No, to our mentors, Sir Lewy, Sir Ewang, no, Sir Joff, Sir Milito Ramos, no. Baka may nakalimutan pa ako, hindi ko nakikita. And of course, very important, the residents. Sir, I must say, without the residents, this will not work. Indeed, they are the future. They are the future of this project. 5 years, these residents, these fellows will become consultants, and they will be doing their private work or their public work in their respective provinces. And doon magpapatuloy, no? If we imbibe this orthogeriatric principle, this multidisciplinary way of treating patients with fragility fractures, no, kailangan dali nila ito pag graduate nila, no, ng residency. Okay. And of course, Professor Passion is Sir Lewy is always very supportive of this, and with him being the incoming president of the APOA, I'm sure mas lalo pang ipopromote ito within the region. Yes, maybe parting words from Sir Lewy.
I'm all out support for your endeavor and your project. I'll fully support it. Yeah. Thank you very much. Thank you very. I enjoyed the launching.
Salamat po, sir. Maraming salamat po. And last na lang, for those, pwede natin buksan yung pictures natin for picture taking, no? Just to, as I've mentioned yesterday, this inauguration or launching will also be included dun sa Asia Pacific Fragility Fracture Alliance website, no? Because they are looking at our project, no, the Philippine project. Because it's really a difficult task to carry out or expand orthogeriatrics in low to middle income countries. No, so they're looking at us as a model, no? Baka for once tayo naman yung gagayahin ng ating mga neighboring countries. Okay? So, Bam, Nika, or Aubrey, pa-picture na lang. Salamat po sa lahat.
I-click mo na, game. Okay na po.
Okay, thank you guys. Salamat. Thank you for spending your time with us. Thank you, and we'll keep in touch, of course.
Thank you.
Thank you, Sir Ewang. Thank you, Sir.
Thank you very much. Thank you.
Thank you po. Bye-bye.
Bye-bye.
Thanks, bro.
Bye to everyone.
Thank you.
Congratulations, everybody.
Thank you, sir.
Afternoon. Thank you.